Hey guys, ECRG here, and today we're going to be talking about most common mistakes I see in the TMF. Hey guys, ECRG here. Today we're going to be talking about the most common mistakes I see in the TMF. Now, the TMF is a huge topic in clinical research because it is the big file, it is the most important deliverable, it is the deliverable that is handed over to the sponsor and is reviewed over and over again. And it has everything in there from the meeting minutes, from all of the site delegation logs, all of the IP temperature logs, all kind of different logs, FDA 1572, investigator brochure, protocol signature pages, that goes on. It houses everything in the clinical trial. So it is very important. And oftentimes throughout the course of a clinical trial, these things go on for years. There are random intervals at which the team will stop everything, come bring everybody together, project manager, lead CRA, maybe some CRAs, maybe some in-house CRAs, and any other people that are working on the trial. They'll stop everything and take inventory of what is in this trial master file and what is not there. So that's called TMF reconciliation. And today I'm going to list some of the common mistakes I see in the TMF that I'm constantly submitting queries for, correcting, reaching out to sites, reaching out to CRAs to see if they can correct it or find a better version of it. So here are the most common mistakes that I see. Number one is naming. And this is just a simple, formatting error. Someone doesn't know how to name correctly in the TMF. And, usually they follow a specific format, but it can be sponsor dependent based on how they want it named, because it is their TMF that they're paying for, so they can determine how they want it. But usually there's a kind of convention that it follows, and it's the location in the TMF. So it could look something like, S.06.04. So it'll be that location, that specific folder. Then it'll be underscore, then it will be country followed by the site number. So let's say, Belgium, it'll be BEL, say site 3, BEL03. Then it's usually followed by the PI last name, and then it's followed after that by the document name. So let's just say SIV confirmation letter, and then usually the date is last. So they usually follow a specific format, and it can be dictated based on the study and the sponsor, but usually there's a specific format that's gone by. And the most common error I find is that it's not in the specific format that it needs to be in. People just throw it in the TMF any kind of way. So when someone is doing TMF reconciliation, they have to go in there and change the name because the name is important. And the naming is important, and you want everything to be consistent, really. So one document has the same kind of naming format as the next document and the next document. And that's the most common mistake I see in the TMF, actually. It's easy to make, and that's probably why that's the most common mistake that I see. Second is the problem I see with actual documents and its signatures being cut off. This happens surprisingly a lot. Probably CRAs are quickly fumbling to scan documents in to their computer and just mistakenly, mistakenly cut the signature off, and the date too. Usually they're on the same line. So normally we have to ask them to rescan it or ask the site to send a clean copy over. So signatures are something that's common that's cut off, and those are important because you need to have a signature and date on pretty much everything. And that's something that is very important and usually can make or break the document. If it's not there, then they're going to want one that is there, or there's going to have to be a note to file filed. A note to file will make it later on this list. The third most common mistake I see in the TMF is missing documents. Now, this really isn't a mistake per se, but oftentimes there are documents that should be there that are not there for whatever reason. For example, if I'm looking at the SIV section and I have an SIV report and a follow-up letter, well, it's clear that I need a confirmation letter because the confirmation letter was written before the visit actually took place. And we know the visit took place because we have a follow-up letter and a SIV report. So we know that the confirmation letter should be there, and it's not there. So that's an issue. So we've got to rectify that by maybe it's in some folder or something, or maybe the CRA has it or something like that. But that's something else. Missing documents is another common one. And then the fourth common mistake I see in the TMF is note to files for things that there shouldn't be note to files for. We gotta stop getting into this habit of writing note to files for just any miscellaneous thing. I feel like note to files are used way too much in clinical research, and if you don't have a document, then you need to really get that document in. Like, there's no excuse for it usually. Usually there's not a good excuse for why you don't have a document. And it gets to the end of the trial and they just want to kind of get it over with, so they just write note to files for everything. Every little error, there's a note to file for it. And that's just typically how it's done. After years and years of work, you just kind of want to get it over with. So that's why note to files are written, and they're very rarely written for something that can't be rectified with a little bit more effort. But that's my big four, the most common mistakes you see in the TMF. So to go over them again, we've got naming conventions, we've got signatures and dates being cut off, we've got missing documents, and fourth, we've got note to files. So that's pretty much it for most common mistakes I see in the TMF. Why don't you guys comment down below what comments you see in the TMF, what mistakes you see in the TMF. Comment those down below in the comments section. Go ahead and like this video, share it, subscribe as always. Email us at eliteclinicalgroup@gmail.com. Become a part of the notification squad, hitting that bell. Reach out, just want to connect with us, or resume review, or any questions about clinical research, you can comment them down below or email us. And that's it for today's video, guys. Take care.